what we saw was that between the start of this decade and 2005, we saw that the number of people living in communities of very high working poverty, where at least 40% of the population was considered working poor or under about $30,000 to $40,000 a year for a family. The population living in those sorts of communities rose by roughly 40% over just the period from 1999 to 2005. That's a pretty substantial increase in that short amount of time, and really, I think, reversed the trend that we saw in the late 1990s, and I think gave back a lot of the progress that we made against concentrated poverty during that time, such that now a larger number of people, and especially a larger number of low-income people, live amid the circumstances I think that we need to be concerned about in cities and suburbs that high poverty brings, which include lack of investment, lack of local job opportunities, poorer performing schools, higher crime rates, and the poor physical and mental health effects that go along with all of those other problems. This study distinguishes between poverty and concentrated poverty. And concentrated poverty is not just about the families themselves and their own economic circumstances, but the economic circumstances of the families around them in the same neighborhood or the same community. And when a lot of people in a community are poor, those families not only face the barriers that their own low incomes bring in terms of affording the necessities of daily life and providing for themselves and their families, but they face the barriers that all the other families around them face and the problems that those families have as well, in terms of the institutions that serve those communities are often overburdened, such as public schools. Rates of crime and disorder tend to be higher in these communities, which research has shown brings ill health effects for families. And these people lack access to the sort of private services that I think many communities take for granted, decent grocery stores and access to transportation and health care. So I think this study is focused specifically on the concentration of poor families in very poor communities and the additional problems that trend can bring. We're finding that poverty in some parts of the United States is reconcentrating, even at the same time that it's suburbanizing, and it's not necessarily evident that these two things can happen at the same time. But I would point to the fact that concentration of poverty relates to poor people clustering in communities of very, very high poverty, really where the effective poverty rate exceeds 40%. That's about 2.5 times the national average. That's a condition that's found most often in inner cities in America. We haven't solved the problem of inner city poverty and the high levels at which it occurs. At the same time, though, we do see suburbanization of poverty, even in the same metropolitan areas where we're seeing increases in concentrated poverty as poor people move into the suburbs for jobs or better school opportunities or other safe communities, other benefits that those neighborhoods can bring. But they are not concentrating in those communities at the same levels that you see in the inner city. So that's why we can have increases in concentrated poverty, people in very high poverty communities, even as more poor people move into the suburbs, but in communities that experience lower rates of poverty overall. The regions of the country that have been hardest hit by the economic downturn and thus have experienced increases in concentrated working poverty mostly include those in the northeastern, midwestern United States, some in the southeast that were heaviest in the manufacturing economy at the turn of the decade. And the manufacturing industry was one of the industries really hardest hit by the downturn, has shed about 3.5, 4 million jobs from its peak in 2000 over the last 5 to 7 years. So those communities experiencing rising rates of unemployment, and that's trickled down really to worsening economic circumstances for low-income people, low-income working people, and the communities in which those workers live. those communities, as a result, have experienced rising poverty rates, and now we see larger segments of the poor population in places like Detroit, Cleveland, parts of Pennsylvania, and even some manufacturing, old textile regions in the southeast, having larger shares of their poor population living in these very, very poor communities. So over the first half of this decade, there were other regions that seemed somewhat more immune from the overall national economic downturn and the slow growth that followed, especially regions in the West, like Los Angeles, San Diego, Phoenix, even Fresno, California, that had strong economic growth for the most part, and experienced declining rates of concentrated working poverty over that time.